In this video, I'm going to give you a brief overview of bipolar disorder and share with you 8 common signs and symptoms of the disorder. Also, this video is timestamped for your convenience, so if you just want to skip ahead to the signs and symptoms, feel free to do so. Bipolar disorder is a mood disorder characterized by abnormal highs and lows in your mood lasting for a significant period of time. Hence the name bipolar disorder. 2 different poles, if you will, of mood swings. And no, we're not just talking about highs and lows that are an everyday part of life or that are expected. For instance, if you win some sort of competition that you've spent the last few months training for, it's very common to feel elated and excited for some time after winning the competition, just like it's very common to feel low for some time if someone close to you dies or something sad happens in your life. These are expected highs and lows, whereas if you have bipolar disorder, oftentimes the mood swings come without notice or without due cause and are really unpredictable. And often you have no idea why you're all of a sudden elated or why you feel on top of the world and very important, or why you're all of a sudden down in the dumps and just don't have any motivation to do anything. When you're on top of the world and feeling exuberantly great, that's known as mania, the up phase of bipolar. And when you're down in the dumps and feeling horrible about yourself, that's depression, the down phase of bipolar. We have a patient diagnosed with bipolar disorder, and sometimes when I see her at her home, she's fairly mellow and pleasant, and then other times she's extraordinarily irritable. She'll posture frequently, she furrows her eyebrows, her speech is very pressured, and her overall mood is intense. Many people I work with say they feel unsafe when she's going through what appears to be a manic phase of her bipolar disorder. Another patient we have diagnosed with bipolar disorder seems to suffer from exactly the opposite kind of mood swings. And he experiences the lows more intensely than our other patient experiences the highs. I'll visit him at his house, and sometimes he'll tell me about all the crafts he's made and how he's very motivated to do his artwork. And then other days he's down in the dumps, has no motivation whatsoever, feels bad about himself, lacks creativity, has writer's block, and reports low self-esteem. Hey, by the way, if you're enjoying this video, please like and subscribe, and let's get on to our 8 common signs and symptoms of bipolar disorder. Number 1, you have mood swings lasting for several days, weeks, or months. So you're either up in the sky or down in the dumps, and this lasts for a significant amount of time, usually longer than a week. You may be feeling great for a month or so, and then all of a sudden, without explanation, you're feeling very depressed. Number 2, you engage in risky behavior. Maybe the last month you've received several speeding tickets, or you've hooked up with way more people than usual, or you've thrown the bulk of your savings into a volatile stock. This kind of risky behavior suggests you may be in the manic or the up phase of bipolar. Number 3, you have a close family member, maybe a mom, dad, or sibling, who is diagnosed with bipolar disorder or who seems to exhibit these kinds of ups and downs in their life. Genetics, like pretty much everything else bodily related in life, seems to play a factor when it comes to having bipolar disorder. Number 4, your sleep is off. Either you sleep too much or too little. You might be sleeping very little but waking up with a lot of energy, or you might be sleeping too much and still feel like you need more sleep. You might feel lethargic and at the same time restless, or you might just notice your sleeping schedule is much different than it was before. Either way, something is off with your sleep. Number 5, you have no motivation. You don't want to get out of bed. Things that used to interest you no longer do. You don't care to socialize. You don't see the point of doing anything, and you're comfortable doing relatively nothing throughout the whole day. Number 6, you don't feel better while taking an antidepressant. In fact, you might even feel worse. You notice your depression doesn't go away. You feel wired but tired. You might even feel more irritable. I would, however, caution this conventional piece of wisdom regarding bipolar disorder and antidepressants, as a number of really good studies suggest antidepressants are no better than placebo, meaning that someone who takes an inert pill, a pill that's not going to have any sort of effect on their body or on their brain, and someone who does take an antidepressant, they don't see a difference in outcome whatsoever. So this very well could be the expected outcome of anyone taking an antidepressant, regardless of whether they have bipolar disorder. However, I thought you should be aware of this information. Number 7, you have unexplained changes in your appetite. So you might notice yourself eating very little for a few weeks, and then all of a sudden you start eating a lot. This also means you might see fairly rapid changes in weight loss or weight gain. One month you may weigh 120 pounds and the next month you weigh 130 pounds or vice versa. Lastly, number 8, you take a mood stabilizer like Lithium, Lamictal, or Depakote and feel way better within a month. Now, this in and of itself doesn't necessarily mean you can diagnose bipolar disorder by giving someone a mood stabilizer and seeing how they feel shortly thereafter. It just means it's another piece of the diagnostic pie, and coupled with some of these other signs and symptoms, it may give you a clue as to whether or not you really have bipolar disorder. So those are 8 common signs and symptoms of bipolar disorder. I also want to say I think it's very important to keep a journal about your moods, your diet, and what happens to you throughout the day to see if you can determine anything patternistic or causal in your life that may account for your mood swings. There are a number of great mood and journal apps out there that are quick and easy to use and can help you potentially identify why you're feeling the way you are. Additionally, humans are very complex. Hormonal imbalances, vitamin deficiencies, stress, our crazy lifestyles, children, all of that and a multitude of other things, some known and some probably unknown, can absolutely contribute to the way we're feeling and may even trigger a drastic shift in our mood. So we really owe it to ourselves, if we're wondering whether or not we have bipolar disorder, to thoroughly examine our life to see if we can figure out what the root cause is of our mood swings. Thanks for watching, and I'll see you on our next video.